The book really has changed how I will design, and as I was writing it, I from time to time would do seminars for my staff because I would become so impassioned about something that I had just read or written, and I think that it's the new focus of patient safety and infection control. I just can't say it enough. I know that there's, a handful of design professionals who are the leaders in the architectural healthcare arena who are aware of these things and who are thinking about it. But from what I see, there's not nearly enough thought going into it. You're still seeing a lot of very generic kinds of patient room layouts and designs, and they just don't have. I mean, I've been doing this for 35 years. If I didn't know, and I do a lot of reading, and if I didn't know most of what's in that book, then I think there's a lot of people who don't know it, and they're going to be shocked. One of the things that was so interesting to me in one of the major themes of the book is designing the patient's experience. And that's a broad topic. Can be looked at in many ways. But baby boomers, who every article you read in a magazine like Time or Newsweek, Business Week, or newspapers, it's always with the same theme, that this is a well-educated group of people, even though it's a very large group of people, and certainly there's got to be some segmentation, but everything points to the fact that these are people who really care about their health, and they want to live to 100, and they're going to be running marathons when they're 100. Well, I made a statement when I was writing it that there, as with any age group, and such a large one at that there's probably an equal number of people who really don't care much about managing their health and are not as described. And one of my peer reviewers, who's a professor, an illustrious professor at a university, said, you can't make a statement like that unless you go and get the data. This is a book on research. Go and get the data. Well, to my amazement, there were some major studies done by the government on this, and exactly what I said, an equal number of baby boomers, the youngest group, as a matter of fact, have a lot of problems, self-reported problems with ambulation, with rising from a chair, walking upstairs. So are those people going to be, are they paying attention to their health? Are they going to be running marathons at 100? I don't think so. And the older group have a lot of problems there are a lot of suicides and problems with drugs and alcohol. And that's what the research shows. Why you never read that in any of these magazine articles, I don't know. So now, if you read the book, that's in the book. And I have gone up after conferences sometimes when someone's been talking to a conference, a group of attendees about the baby boomers, and they never mention that. And then I ask them about it, and they say, well, you are right. That research is all there, but people don't want to hear that. But you need to know that. If you're designing a hospital and you're designing an experience, you need to know who you're designing for. And we're designing hospitals for baby boomers now. I mean, we're not designing it for Gen Xers because they're too young to need health care. So basically, it's this very large group of people that called baby boomers that we're designing for. Now, a subset of that, and this was fascinating for me, and most people don't know this, is that when you talk about literacy, you have no idea until you read some of these major studies how many people in the U.S. are not literate and how many people in your hospitals are not literate. And they will not tell you. The number is something like, 75 or 80% of those individuals are so ashamed of it they have not even admitted it to their spouses, let alone coworkers. So now think about this. If you're a healthcare provider, you are admitting someone for surgery, and you give them the papers to sign, and you assume they're reading it, but they can't read it, and they're just scribbling some signature. So now you think they've read it, and they understand what the risks are, they understand what they're agreeing to. Okay, now fast forward to they're being discharged, and you're giving them very specific, very important discharge information, and you don't understand that they don't know that take a pill 4 times a day doesn't mean take all 4 at once. I mean, there is some amazing research out there that would just absolutely shock you. And so I started down that path, and I said, this is fascinating. If you're a design professional and you're designing wayfinding, you need to know that a lot of people using most hospitals are not literate. So hospital brochures are written at a 10th grade level. Those people cannot read any of that, yet they have adapted. Sometimes they're very bright people, but maybe they've had dyslexia or some sort of learning disability, and that's why they never learned to read, and it just went undiagnosed. They're very good at learning how to get along and not let people know, even their coworkers. They know how to get through the system. So all of that research is in the book too. And there's a lot of very interesting statistics about just odd things that you really need to know if you're designing for healthcare.